And please go ahead, yeah. After
Thank
that,
you.
Sunita.
Thank you, sir, for the kind introduction. And thanks to Murli, sir, and Sipla for giving me the opportunity today to present here in front of you. I was part of this study, and Murli sir had given the opportunity to me to present today to you today. So my topic is management beyond IOP control, modifying ocular blood flow, Indian experience. So we all know that glaucoma is a condition characterized by progressive retinal ganglion cell death, which is associated with visual field loss, in which elevated intraocular pressure is not the only risk factor. There are other causes like ischemia to the optic nerve, dysfunctional vascular regulation, which are important causes which causes progression of glaucoma. So literature has enough proof to say that normal tension glaucoma, IOP independent factors predominate like the vascular insufficiency, vasospasm and translaminar pressure difference. These are the more important causes in the progression of glaucoma in normal tension glaucoma. So this is a typical picture of a normal tension glaucoma with the disc changes and the field changes. So in 2007, World Glaucoma Consensus has reported that lower ocular perfusion pressure, lower ocular blood flow, and vascular dysregulation are important causes of progression of glaucoma other than the intraocular pressure. So with all these background, we understand that the retrobulbar hemodynamics is very important. And to understand the retrobulbar hemodynamics, we should, the color Doppler imaging gives us clue about the velocity and the resistive index. So this is a tool to analyze the retrobulbar vasculature. And literature has proven the association of glaucoma progression and visual field loss with reduction in blood flow and increase in resistive index. So the color Doppler imaging can be measured using a GE Sono CT ultrasound system. It's a basically ultrasound principle with a 7.5 megahertz linear probe. And the color Doppler imaging will be taken from the three major important vessels which are responsible for the vascular supply of the optic nerve, that is the ophthalmic artery, central retinal artery and posterior ciliary artery. So the machine measures something called as the resistive index, which is very important. The resistive index is calculated by the formula. The machine calculates the peak systolic velocity and end diastolic velocity, and the machine gives us the resistive index. So this is the machine with which we did our study. And here we can see the right eye and left eye with the values, the peak systolic velocity and end diastolic velocity values and resistive index. We did the study around 5 years back when we didn't have a normative data. So we did a small normative data in our population. And in that we found that the resistive index also increased with age. This is a normal color Doppler imaging picture. It has a peak and a trough. This is a picture of a glaucoma patient wherein there is no peak, there is troughing, and it's not like a normal patient. So with this background, we decided to study the effect of dorzolamide and timolol on ocular blood flow using color Doppler imaging in normal tension glaucoma patients. At the time of our study, there were a lot of proof in the literature which reported that the dorzolamide increases blood flow and it improves the perfusion. So we wanted to study that with the study. So our study was a prospective comparative double-blinded study. The radiologist did not know what type of glaucoma and any details about that. Newly diagnosed normal tension glaucoma patients were included. Baseline measurements were done, the glaucoma evaluation and color Doppler imaging measurements. And the patients were randomized into two groups, and they were started in dorzolamide or timolol for 2 times for 12 weeks. And then the final measurement was done at the end of 12 weeks. Glaucoma evaluation and ocular blood flow is analyzed pre and post-op. We included all newly diagnosed mild to moderate normal tension glaucoma patients who were willing for the study and who had a reasonably good vision in one eye. And we excluded patients who had other secondary glaucomas, who had other systemic problem because beta blockers could be contraindicated, and who had undergone intraocular surgery or who had undergone other laser trabeculoplasties, who had other inflammatory eye diseases, in whom we could not get a proper tonometry reading and who were using steroids. During the initial visit, we measured the systolic and diastolic blood pressure. We measured the pulse rate. We calculated the ocular perfusion pressure using this formula. We did a detailed slit lamp examination, a gonioscopy examination, and a fundus evaluation. We did a field evaluation. We calculated applanation tonometry measurements, and we did a color Doppler imaging. And then the recruitment of patients were done in the glaucoma clinic. The patients were randomized into 2 groups by the glaucoma consultant, and the medicines were started. Every alternate patient was given temolol. And final CDI measurements were taken at 12 weeks. So our study group had normal tension glaucoma patients, and they were randomized into 2 groups, timolol and dorzolamide. And we did a baseline CDI, and then we did a CDI after 12 weeks. So the results. So we had it was a small pilot study, and we had 11 patients in both groups. And we compared the resistive index pre and post treatment in the 3 important arteries. So what did we observe? We observed that the resistive index was not significant with both drugs in central retinal artery and ophthalmic artery. However, we found a significant reduction in resistive index in dorzolamide group in short posterior ciliary artery. Literature says short posterior ciliary artery is very important, in particular to optic nerve circulation, and any insufficiency in short posterior ciliary artery can affect the optic nerve perfusion. So, so dorzolamide could be one of the probable good drugs in treating normal tension glaucoma, or in patients wherein there is progression of glaucoma in normal tension. And we also observed that there was a slight increase in peak systolic velocity and end diastolic velocity in all the groups, in the dorzolamide group. So coming on to the discussion, the vascularization of the outer zone of retina. Outer zone of retina is directly dependent on the posterior ciliary arteries, which is a branch of the ophthalmic artery, and any insufficiency in that can affect the optic nerve perfusion, and that can cause progression of glaucoma. But it is very difficult to detect the color Doppler imaging of short posterior artery. It requires little skill. The central retinal artery and ophthalmic artery can be easily assessed, but short posterior artery needs a little more skill to detect. And it's been reported in the literature that a decrease in ocular perfusion pressure and a decrease in flow velocities can cause progression. Similarly, an increase in resistive index can cause progression of glaucoma in susceptible patients. Therefore, color Doppler imaging can be used to prognosticate high progression risk. Kaiser et al. Had reported that in normal tension glaucoma, the retrobulbar hemodynamics is more important, and 72% of the published studies on dorzolamide has documented that it increases the blood flow. And the reason for increasing the blood flow is because of extracellular acidosis and selective inhibition of carbonic anhydrase inhibitor. And from our study, we found that there was a significant reduction in resistive index. That means when the resistive index decreases, the progression can be minimized. And it improves the peak systolic velocity and end diastolic velocity. So to conclude, perfusion of the optic nerve head is dependent on retrobulbar circulation, and resistive index can be a prognosticative marker in uncontrolled glaucoma and normal tension glaucoma. As Sir said, we need not do a color Doppler imaging in all patients, but in patients whom we find progression in spite of maximum medications, and particularly in normal tension glaucoma patients, we can definitely consider this tool as one of the armamentarium to find out the reason for progression. And dorzolamide can be considered as a drug of choice for patients with normal tension glaucoma. These are my acknowledgements. They have helped me in many ways during my study. And we have few publications in that. This is my team where I work. Thank you.
Prathibha, you come and sit here. So Prathibha, do you have specific cases where you started dorzolamide and then things became better for the patient?
So theoretically, yes, the resistive index Theoretically, yes, the resistive index had improved, and visual field changes. Uh, visual field changes I haven't observed, but
Yeah, so
the
I think
resistive index.
you have already got those patients, and it will be good to study them in long
Yeah,
term.
we have to follow
You know,
those
then we
patients
can
in long term.
100% prove now. Right now, you have one parameter which says that yes, things are better, and we are very very happy because we all glaucoma as treating everybody is treating glaucoma, and we are so fed up that sometimes we have given everything, things are not improving, so we want to do whatever little we can do for the patient. So definitely this is does open our eyes, and we feel that yes, maybe if we add these kind of medications, our flow would increase. But just a thought, why did you use beta blocker in NTG, which is not normally the given drug?
Sir, there were some studies which had reported that temolol also increases blood flow. So
Oh,
we
okay.
wanted to compare both the drugs and see which one is better.
Okay,